What do all of these movements have in common? Stay tuned for the next 4 minutes to find out and see for yourself. The pelvic tilt is a deceivingly important movement for anyone and any body. We use the pelvic tilt to assess a person's body awareness. What this means is, does that person understand what their body is doing in space? What this might look like is assessing someone's movement, whether it's to do with activities of daily living, such as bending down to stack the dishwasher, or hanging out the clothes, or doing mopping, doing vacuuming, all those sorts of things, as well as assessing their gym-based movements if that's something they do. The pelvic tilt helps a person to place their lower back in a position that allows for efficient mechanics of the lower back and pelvis, not to mention all of the other links to other parts of the body. Having the lower back placed in a position that allows for efficient biomechanics also allows for efficient muscle activation through the area. Having efficient biomechanics is really important to help you reduce the likelihood of injury, pain, and/or discomfort. Today we're going to go through different positions that you can perform a pelvic tilt in so you can get a better idea of what a pelvic tilt can feel and look like. Try these movements and then try to integrate them into your day, whether it's at work, around the house, or what you do for activity. Lying on your back, imagine you have wheels placed either side of your pelvis. Think about rolling your pelvis towards your head and away from your head. You should feel the lower back imprint onto the floor and then arch up off the floor. In each direction, you're passing through a neutral position. You can use your hand under the small of your back to feel the pressure of your lower back either pressing into it or pressing away from it. To challenge the movement further, go onto all fours. Do the same movement as what you were doing on your back. Think about pressing through the small of the back and arching through the small of the back. Try not to let the movement come from the entire spine, much like you would do in a yoga position. Think about pressing your chest away from the floor to help stabilize the upper body and isolate the movement to the lower back and pelvis only. Move into a hip hinge position and ensure you press your chest away from your knees. Perform your pelvic tilt as you have already been doing. As you extend through the lower back, you should feel tension increase through the hamstrings. This is your extreme extension position. Moving into the position where your back is totally rounded will be your extreme flexion position. The ideal position is the middle position between extreme flexion and extreme extension. Integrate this concept into your day. Think about brushing your teeth, particularly when you go to spit over the sink. Think about moving into a hip hinge position, ensuring that your back isn't too flexed or too extended. You should feel a comfortable position in your hip hinge as you bend over the sink. The same can be said for when you pack or unpack the dishwasher. Think about moving into a hip hinge first and then using the knees to bend further if you need to get lower. That feels good. Being an elite table tennis player is made possible due to the easy application of the hip hinge during a match.